agreed to, and I call the member for Higgins.
Thank you, Mr Deputy Speaker. I rise to speak on the National Health Amendment enhancing the Pharmaceutical Benefits Scheme Bill 2021. Mr Deputy Speaker, the PBS, as it's known, the Pharmaceutical Benefits Scheme, is a bit like the way the Australians view the PBS, a bit like the way the English or the people in England view the NHS. It's something that people know, that they care about and that they trust, and they want their government to deliver the best PBS possible. And that's because every Australian knows that at one point in their life they may have to rely on the PBS, and we know that many millions of Australians currently rely on the PBS. So the Pharmaceutical Benefits Scheme serves to give Australians affordable access to quality medicine, and it's something everyone in this House, I think, should be very proud of, because the PBS is being supported by this government, but it has been supported over many, many years by many, many governments in Australia. Importantly, since this government came to power in 2013, nearly 2,800 new medicines have become available through the PBS, and they're all government subsidised to ensure that the health of those citizens of our country is maintained. Mr Deputy Speaker, the amendments in this bill reflect the new 5-year agreement with Medicines Australia and the Generic and Biosimilar Medicines Association. This agreement seeks to ensure that Australia has a strong supply of medicine, with Australians able to access breakthrough medicines as early as possible. Mr Deputy Speaker, these new agreements, the government and the medicines industry have co-developed as a comprehensive package of reforms for the PBS, will ensure that Australians can continue to gain access to new breakthrough medicines as early as possible. It will also deliver a robust and uninterrupted supply of medicines needed and used every day by Australians. And it will, more importantly and just as importantly, keep the PBS on a long-term sustainable footing. The industry agreements will achieve this by securing commitments from the medicines industry, which will result in new savings from improved statutory price reductions, which will be reinvested in the PBS, as it should. And this reinvestment will in turn help to make headroom on the PBS for listing new medicines. And this is very important because we need to get the balance to enable headroom to be provided so that we can get new drugs onto the PBS. Now, Mr Deputy Speaker, this bill will see patients on average save due to the decrease in a large number of PBS medicines. The reforms are expected to save nearly $2 billion over the 5-year agreement and will target Commonwealth investment towards securing strong supply of commonly prescribed medicines that have suffered supply chain issues in recent years. Moreover, this bill guarantees over $5 billion of new investment in PBS medicines listings over the lifetime of the agreement to 2027. Seems like an odd year to say 2027, it's just around the corner though. This commitment helps guarantee that the government can list new medicines as recommended by the Pharmaceutical Benefits Advisory Committee as and when they become available and approved. Mr Deputy Speaker, the bill will reinforce a strong supply chain to ensure that Australians are not left struggling to find the medicines they need. Now, we all know we've been through a pretty dramatic COVID pandemic, and through 2019 and 2020, over 500 listed medicines on the PBS have wrestled with medium to critical impact shortages, particularly medicines sold for $4 or less per pack, and these were found to be most susceptible to these shortages. And this bill seeks to reconcile these issues. Now, these medicines suffering shortages included those that treat depression, schizophrenia, high blood pressure and many more illnesses, and certainly these patients cannot afford to have supply chain interruptions. I know I have family members affected by some of these conditions, and certainly supply chain interruptions is devastating to those patients. It's important that they know that they can be sure of a secure supply of medicine. And through COVID last year, I know that there was particularly a short supply, a supply chain issue of paracetamol, for example. I don't think many people knew some of the struggles that this government had to ensure it dealt with in what was a pandemic coming at us at speed. Like being in a great aircraft with both the Spanish flu and the Great Recession coming at us at speed, or Great Depression coming at speed, there were a lot of things that had to be dealt with. And the Minister for Health, the Honourable Greg Hunt, was dealing with some of these supply chain issues himself. And I have a constituent in my electorate who is the CEO of Australia's largest generic pharmaceutical company, Arrowtech, Dennis Bastis. And he called me up and he said, Katie, I'm having problems with the supply chain of paracetamol, being the CEO of one of the largest generic pharmaceutical distributors. And we had to work through DFAT and work through diplomatic engagement. And finally, we actually had to take it right up to the top level to the Prime Ministers of both our countries to solve the supply chain issue with India in order to access paracetamol. Can you imagine the babies of Australia not having access to paracetamol? The people who are dealing with fever at home and unwell not having access to paracetamol. So it was actually quite a critical shortage. And I know that there were many shortages over the last couple of years. And of course, they've been dealt with because the Minister for Health is, what I'd say, very effective at securing his supply chains. He gets in front of the problems before they can actually cause problems to patients. But we know that he has been having to deal with these problems behind the scenes and on behalf of Australians. And legislation such as this will help the Minister of the day, in this case Greg Hunt, to deal with supply chain issues. So in order to maintain a strong supply chain in this country, medicines with prices at or below $4 will not have their price reduced under this Act. Moreover, medicines with very cheap ex-manufacturer price will undergo modest price increases to ensure that manufacturers can secure strong source of supply in the global market. Now, in light of the increased investments by the medicines industry to ensure this strong supply chain, a price reduction floor will be introduced to support the pharmaceutical industry. So this is the balancing act that the Minister for Health needs to do to make sure that we get the best outcome for all Australians and, of course, to make sure that the taxpayers' dollar gets well invested. This amendment serves to support low-cost medicines so that these manufacturers can compete in what is a very aggressive global market, as well as invest in supply chain resilience. Now, Mr Deputy Speaker, when a PBS-listed brand is protected by the price reduction floor, as previously mentioned, they will be under strict obligation to hold large amounts of stock in Australia. This will ensure the supply chain issues are not damaging to the Australian environment. Mr Deputy Speaker, this bill acts to employ stock holding requirements requiring manufacturers to hold at least 4 months of typical demand of stock on hand. And this amendment will almost universally apply to all medicines with prices below $4 to ensure that those struggling in this country with illnesses that are affected by these medicines can rest assured that they will not have their important lifeline of medicine cut by supply issues. The amendments in this bill will ensure sustainable supply for the Australian people of the medicines they need, as well as supporting the medicines industry to invest in holding greater stock of medicines most at risk of global shortages and investing in greater supply chain resilience. Now, Mr Deputy Speaker, since October 2013, the Coalition Government has approved approximately 2,800 new or amended medicines listing on the PBS at an overall investment by the government of $14 billion. This is something that taxpayers should be very proud of, the investment of their funds to make sure that Australians can get access to secure, reliable, highly efficient, highly impactful medicines at a very reasonable cost. Mr Deputy Speaker, the Morrison government has a demonstrated history of support for the PBS. In the 2020-2021 budget, nearly $900 million was invested by this government in new and amended listings as part of the scheme. This includes for breakthrough treatments for cancer, depression, eczema, attention deficit hyperactivity disorder, pulmonary arterial hypertension, asthma, migraine and Parkinson's disease, just to name a few. Now, notably, a medicinal cannabis product, cannabidiol, is now included on the PBS for use in treating Dravet syndrome, which will save more than 100 Australians and their families over $24,000 a year in costs. This is really important because these children who are usually affected by Dravet syndrome often have very difficult lives and not necessarily the means to support themselves with this incredibly helpful drug that helps make such a significant difference to their lives and their quality of life. Further examples of what's been listed on the PBS includes ofatumumab. I'm giving the generic because it's very important that we list generic drugs, listed on PBS for the treatment of relapsing, remitting multiple sclerosis. And I know so many people, families, friends, patients who've had multiple sclerosis, can be a devastating condition. And around 5,000 patients a year will benefit from this listing. Without subsidy, patients could pay $28,000 per year of treatment. So you can imagine someone who's affected by multiple sclerosis, may not have employment because of their condition, their chronic health condition, to be able to afford a treatment that costs $28,000 per year. That's an enormous undertaking. So you can imagine the relief of patients who have relapsing remitting, meaning it keeps coming back and it keeps getting worse, multiple sclerosis, to be able to have a treatment that will offer them support and better quality of life is indeed something that we should all welcome and feel very proud of. A further drug is from the 1st of September 2021, is cariprazine. Cariprazine. It's always getting the names right can be quite tricky even for a doctor. Listed for the treatment of schizophrenia. This would mean that 39,500 people will benefit, saving them each $1,200 per year for treatment. From October the 1st, 2021, I'm really going to struggle with this, brolucizumab, listed for patients with wet age-related macular degeneration, a terrible chronic eye condition that causes blurred vision or a blind spot in the visual field, and people can lose vision, and it can be quite a serious condition, with 12,800 patients who will save around $8,800 per year per treatment, or for treatment over that year. So these are treatments that cost hundreds of thousands of dollars per year, and they can be out of reach for so many. But instead, on the PBS, they will pay $41.30 per script, or $6.60 per script if they have a health concession. Another drug that has been listed from June the 1st, 2021 is progesterone, or Oripro, to prevent women going into premature labour, saving around 14,250 women up to $300 per course of treatment. Or a further drug is dexamphetamine, which has been expanded to include patients who are diagnosed with ADHD after they turn 18 years of age. And we know ADHD is a problem that affects so many people, particularly children, but as they grow older and they want to continue to take treatment, around 20,000 patients could access a comparable treatment for this condition and could benefit from this new treatment option. Without PBS subsidy, patients might pay $1,200 per year for treatment. And finally, a treatment which is ipilimumab, which will be expanded for use in combination when treating patients with unresectable malignant mesothelioma, which is a lung condition that can occur when people have had unexpected exposure to asbestos. And over 700 patients a year may benefit from this listing. Without the PBS listing, patients may pay around $130,000 per course of treatment, a huge amount of money, and it's wonderful that these drugs that only affect a small amount of Australians, but it could be any of us. I know recently a family friend actually picked up some tiles when he was renovating an apartment block and found to his horror that there was asbestos underneath these tiles. Hopefully he hasn't had a harmful exposure, but it was a fright that he got, and obviously you never know when you may get exposed to asbestos, so it's great to know that our medical system, our health system is protecting people and supporting people to protect lives and save lives. So, Mr Deputy Speaker, this bill will serve to offer low medicine prices for Australians whilst improving the supply chain that helps Australians get what they need. The Morrison government's commitment to the success of the PBS is clear. With a strong record of new medicines being listed, and now this bill being brought forward so that the Australian people can continue to have faith in this government's management of medicines listed on the PBS, and that they can work well hand in glove with the pharmaceutical companies and Medicines Australia to ensure a balanced outcome that supports a cost-effective way of ensuring both supply chain issues and cost of medicines are kept in check. It is vital that every Australian retains their ability to access medicine, with any shortages unacceptable, as this country strives for a system whereby each and every one of us can access affordable and effective medicine. I commend this bill to the House. Thank you, Mr Deputy Speaker.